So today we're gonna learn how to use the iontophoresis.
Okay, we have a 2 iontophoresis machine in our school, but this one is a little older model because that one you can you have to turn on both the current and the treatment time. You have to set up both so you can to make sure the patient has the treatment properly. And also the very important things you have to make sure and check the patient's skin condition before the treatment. Check there's no any lesion, there's no any rashes, and also when you put it on the iontophoresis, put on the pad, always ask the patient before, do they have any allergy? Also during the treatment, keeping ask the patient about their comfort level. If they don't feel comfortable, you have to decrease the intensity. If they complain about something like burning, something about pain, something about the allergy, you should stop the treatment. Also after the treatment, so you also have to check the patient's skin condition to see the same thing. Okay. After you finish the treatment, remember always document if there's any abnormal observation. Iontophoresis machine is for delivering the drug and into your skin, and that will be bring the drugs, have the medication which can treat the patient for chronic inflammation, for pain relief. So the iontophoresis machine is very simple, and the knowledge behind this is very simple. So the same charges repel. So if the drug is positive, so you would put the red cord as a positive, so they can push the drugs into your skin. So the iontophoresis is like all other Eastern machine. You need a 2 pad to complete the circuit. This pad is for the treatment pad. So you will place your drugs on the pad and then place to the treatment area. Like for example, for the patient have a carpal tunnel syndrome, so you will place a pad on the carpal tunnel syndrome on the wrist. So the other one will be dispersive pad. So you can just put it anywhere. You can put it by bicep. You can put it on the arm, no problem. So and after you place the pad, okay, you will connect it. Always remember the same charge repel. If we are using the lidocaine, which is the positive charge, so we are using the red cord to connect with the treatment pad, and use a negative cord to complete the circuit. And for the parameter for the iontophoresis is very straightforward. It's very simple, and there will be the research suggests the 40 milliambit per minute will be the best for the patient's treatment. And so now we were doing the setup for the current for the intensity. So we will start at the 4 milliambit for the patient. So the iontophoresis machine will be automatically set up the time for 10 minutes. If the patient didn't feel comfortable because it's a DC current, so you can decrease the intensity. At the same time, when you decrease the intensity, the treatment time increases.
Hi, today we're going to learn how to use lasers. First of all, we turn the machine on, and now we introduce ourselves to the patient, we tell them what we're doing, and we ask them questions. Today we have a patient with carpal tunnel syndrome. And so, hi Freddie, I'm Shandy, I'll be your physical therapist assistant for today, and I'm going to be using laser on your wrist. And so first of all, you want to inspect the area, make sure nothing is in there. So Freddie, would you like to take your watch off?
Yeah, sure.
You also want to ask questions. So hi Freddie, did you have any x-rays in the past 6 months? Are you taking any medications like Benadryl, Flexeril, or any oral contraceptives? And if they don't have any x-rays or medications, we can do laser on them. So since we're just using a laser, so it's gonna be just port 1. Okay, click the port 1, and then for default, for manual setup, you push enter. And since we're treating a carpal tunnel syndrome that falls in the category of neuropathy and chronic soft tissue inflammation, and since the patient is first time for this, so we're gonna do 10 joules. And the machine will do the time for you. You hit enter, and then for first choice you would use continuous, so that would be 0. And for that we can begin our laser treatment. Now we are ready to treat the patient with laser. So first of all, for safety precaution, you would want them to wear these awesome goggles. Please wear this, Freddie, for your safety. And make sure the patient is comfortable with his position, and put the laser on the skin. Make sure it's really contact with the skin, not like this, okay? And we can hit the trigger to start the treatment. Okay, now the treatment is done. So for safety, before taking the laser off, make sure that you put the cap, okay? And then put it back to the machine. So now the treatment is done.
By the way, as you can see in this table, there are different ranges of doses that you are going to use for different kinds of conditions.
Also, for the treatment to be more effective, we can do cryotherapy before the laser treatment.
Alright, so next we're going to use some laser with SLD. First we have these two, this is for laser and this is for SLD. And first, you have to know your milestone, so you know the right placement of the SLD and where to put the laser. Right? First, you have to turn it on.
You can do both for Fremont.
And first, you have to let the patient wear the glasses. And you have to, just as I said, you have to know your milestones. So you'll know the placement of the SLD and where to treat with the laser, right?
Yeah.
For now, we're going to do lateral epicondylitis, so I'm going to put the SLD on the muscle belly of the wrist extensors.
Plus, minus, minus. Inflammation plus, proliferation, the inflammation. Yeah, plus. Minus, minus.
And now we're going to set it up. First, if you could come closer so you can see.
Yeah.
Alright, first you have to press 2. Alright. And then enter. And manual. Alright, for lateral epicondylitis it will be a soft tissue inflammation. So we have its dosage is 2 to 8 joules, so we're going to start at 2. Because it's the first, it's patient's first time for the treatment. Right, then answer. And continuous or manual, we're going to start with continuous. Alright. Now to begin, we have to put, before we begin, we have to put the laser on the skin before we start. Alright, answer. Alright. So to start treatment with the laser, you have to, if we could come closer. We have this trigger over here. Alright. And we're going to start at the lateral epicondyle, the tendon. Alright, then change. Remember, you don't want to put do the laser treatment at the same spot. You have to move it. Yeah.
Do I have to work? No, right? As long as it's an allocation. Okay. All right. So we just ask 3 plus 4. Ask 3 plus 4.
Alright, the treatment is complete. So before you lift the laser from the skin, you have to prepare the cover. Then cover it right away, just in case. Alright. And that was that. Alright, so before the treatment and after the treatment, you have to inspect the skin for any abrasions or any abnormality because of the laser. And that's about it.
Metal implant.